That's a very good point, because we also don't want to scare the people who own the data and to provide the access. Now that, now in the machine learning era or the deep learning era, everything is built based on data. So when personal data is used, there are all kinds of concerns that are there today or may arise tomorrow. So the patient may want to, or the owner of the data may want to withdraw the consent, etc. So in general, in this data and concerning, access to data, consented data, etc., what are the policy frameworks out there in India, especially, or elsewhere in the world? Since you are also part of the author of the digital ABDM, the policy document, and now the DPDP Act has come in. What are the policy frameworks out there, and how do people navigate that?
Yeah. I think this is a very relevant question to ask. We need a lot of education, also an awareness on this aspect. We have the Digital Personal Data Protection Act, which has been notified by the Government of India, approved by the Government of India. And we know the contours of what kind of data protection law will prevail in this country in the years to come. Why I'm saying in the years to come is it's not yet operational, in the sense the rules are not yet formed and so on. But we know where we are heading and the kind of implications of the data protection regime that's going to come here. So it actually puts the health data in the form of a personal data. So the provisions of personal data protection, Digital Personal Data Protection Act, come squarely and apply to the health data, which is also more sensitive than the regular data. So non-personal data versus personal data. So it becomes squarely a personal data and then attracts all the provisions of the Act here. And we have to wait and see the way it works out in real field level once the rules are notified. And also one peculiar thing here is that the DPDP Act in India is formulated in such a manner that there is a lot of responsibility and obligation cast on the various ministries, respective ministries, to formulate the detailed procedures. The DPDP Act itself doesn't, it's not a procedural act in that sense. It's a very high-level indication of the direction. So it is the Ministry of Health which needs to come out with detailed operating procedures as far as data protection is concerned in India. So I would presume that by end of 2025, we'll have complete, regulatory clarity, and the regulatory ambiguity will be removed reasonably completely by end of this year, once the Ministry of Health comes up with the operating procedure on how health data should be, can be shared, with what kind of consents and what kind of safeguards in place, and what are the duties, roles and responsibilities of the data fiduciaries like hospitals and research institutions and the labs, etc. So we have to wait and see, but it will be significantly consent driven, and also it has the principles of privacy, which are, privacy by design. We talk of privacy by design today, which means that in the very design of any scheme or any program or any, aspect, operation that you are doing, by design it should protect the privacy and not retrospectively. Having, burnt the fingers, then you can't simply retract and say, now I will protect the data or protect the, data related to a person. No. Proactively we have to protect that data. So that much is very clear. That's in consonance with what's happening globally in this area. And a little bit about, the other act directly coming into, there's no legislation as such on AI for healthcare. The closest we have is the AI Act of European Union, EU, has issued a AI Act, Artificial Intelligence Act, where they have prohibited certain items altogether from where they see a risk, a high amount of risk. So they have prohibited, and certain other categories they have put as high risk AI interventions. So health data I did not find in either of these categories, but there are obligations cast on those who are dealing with AI solutions, which are in terms of right from the entire life cycle of the development of AI solution, there are obligations cast on the innovator to report it, to correct any of the digressions from the data protection obligations, and then any harm that's happening. Yeah. So currently, net what I'm saying is that in India, by end of 2025, we'll have regulatory clarity on AI for healthcare and health data. Globally, it's beginning to happen. We've seen it in already operation in Europe so far. Yeah.